Respiration is the first assessment because it is the most critical function. If the patient is not breathing because of an obstructed airway, attempt to clear the airway. Depending on the type of obstruction, either reposition the patient's head or remove any debris that may be lodged in the throat. While repositioning an injured patient's head may be contrary to what you've learned about cervical stabilization, Dr. Greg Super explains how to handle a patient who's unconscious and not breathing.
If we do nothing, he's a certain field death. If we open his airway, we may aggravate an existing cervical spine fracture. We chose to make that intervention. If we open his airway, he makes attempts to breathe, and we can keep that airway open, he may have a chance to survive. If we leave the airway closed, he has no chance.
If respiration cannot be reestablished with these simple measures, don't waste time attempting CPR.
The first rescuer's basic instinct might be to begin CPR on the first one he encounters. That would be a mistake. These people die. If the first rescuer goes to CPR on the first victim he finds in full arrest, he will not be available to help those who still have a chance at living.
Non-breathing patients are considered non-salvageable and are categorized deceased. Move to the next patient.
Yeah, you need help over here. Need you to help support his head. Okay, just like this. Need you to help keep his airway open. Just like that, okay? Great. Don't let the airway close.
If the patient begins breathing after the airway has been cleared, categorize immediate and move to the next patient. To assess respiration on a patient who is breathing, observe the frequency of respirations. Patients who are breathing at a rate of more than 30 respirations per minute are categorized immediate and no further assessment is done. Move on to the next patient. Although you won't take time to actually count respirations, you can become skilled in visual assessment by watching others simulate rapid breathing. With practice, you will be able to easily differentiate between a person who is breathing faster than 30 respirations per minute and one who is breathing at a normal rate. If a patient is breathing slower than 30 respirations per minute, proceed to the next assessment, perfusion. Here's how the respiration assessment looks on the START flowchart. If the patient is not breathing, reposition the airway. If breathing does not resume, the patient is non-salvageable and is categorized deceased. If breathing resumes after you clear the airway, categorize the patient immediate. Patients who are breathing at a rate of more than 30 respirations per minute are categorized immediate and no further assessment is done. If the patient's respiration is slower than 30 respirations per minute, proceed to the second assessment, perfusion.